There, of course, has been a lot of progress in COVID-19 vaccinations. We now have 3 authorized vaccines, more people are eligible, and more locations to receive the vaccine. In today's To Your Well-Being, we're going to talk about where we are now with the vaccines and what you need to know. Cone Health Chief Pharmacy Officer Dr. Deanne Brooks is joining us. So let's kind of talk about to date, how many COVID vaccines has just even Cone Health provided?
Yeah, so we're really excited because we actually announced today that we have delivered over 100,000 COVID-19 vaccines to our to recipients within our community, and so we're really excited to have been able to reach that milestone.
Yeah, that is a huge number, 100,000 just for Cone Health themselves. Okay, so let's talk about who is currently eligible to receive a vaccine in our area.
Yeah, so right now, as many of you have heard, the state has a prioritization framework, and there are 5 groups. We're currently in group 4, and so what that means is that everyone in group 4 and above, meaning 1, 2, 3, and 4, are eligible for the vaccine. So if you're a healthcare worker, if you're over 65 years old, if you care for someone at home, if you are an individual who is an essential worker, and now, starting on Wednesday, the other piece of Group 4 is opening up. So if you are living as a student and you're living in a dormitory, you may also receive the vaccine as well.
Okay, now if you're eligible, the first thing people want to know, how do you register for the vaccine with Cone Health?
Yeah, so with Cone Health, you will go to conehealth.com/vaccine, and you will see appointments that are available today. We now open up appointments every Monday, and those appointments are available at our 3 fixed sites in Rockingham County, in Guilford County, and in Alamance County. And there are also vaccine appointments available at the FEMA site as well, but we do have appointments available right now for this week within Cone Health. And then once those appointments become full, you can sign up for email notification to be able to be notified whenever more vaccine appointments are open. And so we're doing that on a weekly basis.
All right, and so this is a very common question. People want to know what shots are available at Cone Health, and do they get to pick one?
Yeah, we do get that question quite a bit, Tanya, and we don't get to pick them right now. So we do have the Pfizer vaccine and the Moderna vaccine, and we have had some Johnson & Johnson vaccine as well that we have been distributing to and administering to our community members. And we don't have a choice right now because we want to keep it very safe, and so we're keeping our vaccine clinics with the specific vaccine that we have available at that time.
All right, so let's talk about this newest vaccine, Johnson & Johnson. So we want to know a couple of different things. So let's go down, like what's the effectiveness, and then how does it compare to Pfizer and Moderna?
Yeah, so starting with effectiveness, it's very effective. It's really 100% effective at preventing death and severe hospitalization. For really severe illness, it's 85% effective, and so it's very close to the other 2 vaccines as well. It also works to provide your body with the antibodies against COVID-19 in a different way, but it's also similar to make sure that your body is going to create antibodies to that spike protein for COVID-19.
All right, and then let's talk about the side effects, because I think some people think, well, if I just get 1 shot versus a 2-shot dose, I won't have as many side effects.
Right. And so the side effects are fairly similar. The biggest side effect is you're likely going to get a sore arm whenever you get the vaccine. You can have some feelings of just feeling, some people will call it just feeling blah, and can get a headache potentially. And in terms of first dose versus second dose, and if you only get 1 dose, the Johnson & Johnson vaccine does, in the studies, it did seem to have a milder side effect profile. And so it is a possibility that folks might see less side effects in that. But overall, the side effects for all 3 vaccines for most people are not problematic, and there aren't the severe side effects.
All right, so when we talk about like the vaccines and the communities of color, let's talk about some of the steps that Cone Health is doing to reach those communities and to get those vaccinations done.
Yeah, so we have a commitment that 35% of our vaccine appointments will be dedicated to putting the vaccine in the arms of our Black and Brown communities. And we're doing that in several ways. We are working with faith and community leaders to be able to do that. And we are also a spoke site for the FEMA vaccine hub site that is at the Four Seasons Mall. And in Alamance County, we are at the Gate City Dreams Center, and we are particularly focused on our Latinx population there. And we have really, between our church and community partnerships, as well as the Dream Center, we've really been able to meet and exceed that goal.
And what would you say to people who are still just very kind of hesitant about getting the vaccine, and given the history of sometimes vaccines and medical procedures and things, what would you tell them?
Yeah, I would tell them to certainly speak to medical professionals about their concerns and to trusted members of the community. These vaccines have been tested in people of color, and we do have a history that we have to acknowledge as well with vaccines and other medical experiments that have occurred that are tragic. So we have to acknowledge that, and we also need to understand what someone's hesitance is to taking that vaccine. And so I would say to educate yourself and ask those questions to people that you trust. There's a lot of information out there on social media that might not be so reliable, and talk to other people who have had the vaccine and ask them how they came to that decision as well.
Mm-hmm. Yeah, and I think that is definitely the thing, is when you hear from someone else who said, yes, I did have the vaccine. This is what happened when I had the vaccine, or this is what didn't happen when I had the vaccine. Any final thoughts before we move on to our text Q&A?
Yeah, I just want to just remind everyone to, when it's your turn, please get the vaccine. Right now in the United States, we're right about the 30 to 35% of folks who have at least gotten a first shot of the vaccine. And this is how we will be able to have our time with loved ones again. And so, and during this time, it's very important for us to continue wearing our masks and washing our hands and waiting 6 feet apart. COVID-19 is still out and about in our communities, and we do still have spread of it. And so it's very important for us to understand that, how important it is for us to all get vaccinated.
Mm-hmm. Well, Dr. Brooks is going to be with us until 6 o'clock answering your coronavirus questions. Now, here's how you get one of your questions in front of our expert today. You text us that question. The number is 336-379-5775, and we'll be right back.